CPR on an infant. First, check for danger. Are you or the casualty in any immediate danger? If yes, then remove the danger. But if that's not possible, move the casualty. Now, try to get a response from the infant by squeezing their shoulders or tickling their stomach or feet.
Can you hear me?
If there's no response, send for help. Call for an ambulance on 000, or if another person's available, ask them to do it.
Quick, call an ambulance.
Open the airway by checking the baby's mouth and leaving their head in a neutral position. Remove any visible, solid material with a little finger sweep. Once the mouth is clear, check for breathing. Look, listen and feel for any breathing. If they're breathing, gently roll them onto their side or hold them on their side in the recovery position. If you can't detect normal breathing, then start CPR. 30 compressions of the chest, followed by 2 breaths. Here's how. Place 2 fingers in the centre of the chest. Push the chest down by approximately 1/3. Now, do 30 compressions in time with the flashing indicator on your screen. Count out each compression until you reach 30. We'll wait while you do that. Reached 30? Time for the 2 breaths. Support the chin, completely cover their mouth and nose with yours and give them a small puff of air. After each breath, look for the rise and fall of the chest. That's all the breath you need, enough to lift the chest. Continue CPR at 30 compressions to 2 breaths until normal breathing returns or the paramedics are ready to take over. As you continue to provide 2 breaths, make sure that the chest rises and falls each time. If the chest doesn't rise, it may mean that the airway is obstructed. Support the lower jaw and avoid pressure on the soft tissues of the neck. If the baby is still unresponsive and not breathing normally, continue CPR until help arrives. If you have a defibrillator, ask the 000 operator for advice on whether you should attach it. When the ambulance arrives, the paramedics need to get to the casualty as quickly as possible, so have someone ready to meet the ambulance.